Talofa and welcome. You are watching Editor's Choice. Today's edition focuses on the Samoan government's move to prepare the country to live with COVID-19 as the new norm and gradually moving to open the country's borders. You can find all the details on our website, talaia.com. Today is Wednesday, 30th of March 2022, and this is episode 3. Let's get into it. The Samoan government is preparing the country to live with a new norm of COVID-19 virus and looking at a gradual opening of its borders. In an update on Monday evening of the latest lockdown conditions, Prime Minister Fiamenao Mimta'afa stated,
"It also provides room for different sectors of the economy, including the private sector and the community, to finalize their response plans going forward to reflect the new norm of living with COVID-19 and identify the best ways to move forward with the gradual opening of borders."
When the current Alert Level 3 was enforced on Friday the 18th of March until Tuesday the 5th of April, the government was to review the situation by yesterday, Tuesday the 29th of March. The community cases have increased rapidly from the first community case on Thursday the 17th of March to 1,493 as of 8 a.m. today. The numbers are still growing daily and rapidly. More than 90% of the cases are based in the main island of Polu, and about 3% are in Savai. As of compiling this episode, there are no cases in the intensive care unit, and all of the cases that were isolated at the National Hospital Mototua have been discharged. According to the Prime Minister, critical to this review are recommendations for the next course of action from the Disaster Advisory Committee.
At its meeting this afternoon, Cabinet was advised that we would be receiving 70,000 doses of the Pfizer vaccine tomorrow afternoon. This coincides with the plan to commence the mass vaccination of booster doses on Thursday this week in Polu and on Friday in Savai. The vaccination rollout will coincide with the mop-up campaigns for the first doses of the pediatric Pfizer for the 5 to 11-year-old cohort and the second doses for the 11 to 17 age group and 18 plus.
But 12 days since the very first community case was confirmed, the frontline medical staff are already diminishing, and the ministry is now employing skeleton staff as the number of frontliners who have tested positive are being isolated and are increasing. According to the Prime Minister, the plan is to allow frontline workers space to recuperate and to roster their teams with assistance from the private health sector. This will ensure the continuity of the national COVID-19 response, as well as commitment to other equally important health services, such as the national immunization programs, to be delivered in a safe environment. With the rapid surge of new infections, the aim is to slow down transmission and push the vaccination drive to achieve the targeted coverage required for herd immunity. It is clear from clinical evidence that chances of developing acute symptoms of or likely death from COVID-19 will be minimal with complete vaccination and a booster dose. It is important for all to get maximum protection by completing all vaccination given the prevalence of non-communicable diseases in Samoa. Cabinet has approved the continuation of the second week of Alert Level 3 for Samoa, commencing Tuesday the 29th of March 2022 to midnight of Tuesday next week, the 5th of April. The state of emergency orders have also been amended to ensure that the public continues to access essential services and to replenish their food supplies. The opening hours for essential services have been opened from 6 a.m. to 4 p.m. on Tuesday the 29th of March, Thursday the 31st of March, Saturday the 2nd of April, and Tuesday the 5th of April. Meanwhile, the Acting Director of Health, Tangaloa Dr. Robert Thompson, said it is too early to project when the infection will peak. He said this depends on multiple factors, such as the vaccination coverage, climate conditions, and safety precautions, such as social distancing, wearing facial mask, washing hands, and keeping basic hygiene. He also said that Samoa is only in the first wave, and there could be a second or third wave. He also said the ministry is still awaiting confirmation from New Zealand of the variant that is now infecting the country. As of 8 a.m. today, 1,493 community cases have been confirmed. The bulk of the positive cases are between the ages of 15 and 54, and there are 60 cases of children under the age of 4. That's our editor's choice for today. For details and more on these stories, please visit our website, talamua.com. Stay safe, Samoa. Manuia le ne yaso. God bless.